Basically, our motivation, what keeps us working on this, is that we know that there's a tremendous unmet medical need for Huntington's disease especially. There's only one FDA-approved drug for Huntington's disease. Huntington's disease is a complex neurological disorder that involves psychiatric changes, cognitive decline, and changes in motor coordination. The FDA-approved drug currently lessens motor symptoms, but it does nothing to improve the cognitive decline or the psychiatric changes. It also has a number of side effects that are undesirable. Patients really struggle, and it's very devastating because Huntington's disease is a dominant genetic disorder. It runs in families in every generation. So if one parent has it, then their children will have a 50-50 chance of inheriting the disease gene. And if you have the disease gene, then you will have a 100% chance in developing the disorder. What we really need to do is achieve the proof of concept in a phase 2 clinical trial. That's like the big one, which is a major value inflection point for the company as well. So that's our ultimate goal that we're setting our sights on. A lot of our planning and strategizing and pounding the pavement and talking to KOLs and what do you want to see in our clinical trial design. We talk to people with regulatory expertise. We talk to investors. We ask them, what do you want to see us de-risk in our program to make it attractive to you? We ask the same questions to potential pharma partners. We just need to find all the angles for all the stakeholders to make sure that our plans are addressing all the needs of those additional stakeholders. So our planning's in place for that. Our IP is going to come likely this fall, and then that will help set the stage for investment. Timing for starting clinical trials would be in about 1 to 2 years, and that really, the variance around that revolves around what we will see in the remaining preclinical work that needs to be done. We're looking for investors, but also smart money. So because we're a small virtual company with a small number of employees that uses outsourcing to move the programs forward, we need a lot of expertise that comes along with the money. So when we're seeking investors, we're looking for investors that have teams that are experienced in pharma development, ideally in neurology, and even more ideally in neurodegeneration, and even more ideally in the specific disease areas that we're working on, so Huntington's and Parkinson's disease. But also, we would consider working through this with a pharma partnership. Usually pharma partnerships want to come in after phase 2. They want to see your phase 2 data before they come in, but in some cases they come in early. So we do speak to interested pharma partners, and we let them know how things progress as we move along with our smaller milestones. So there's multiple ways to move forward with funding. A slower way to move forward is just through orphan drug development programs that are essentially grant funds. So there are a number around the world. NIH offers orphan drug programs. Also, the European Horizon 2020 program is very good for that too. So we keep all of our options open. We will try every single opportunity we can that comes forward.